Bismillahirrahmanirrahim. My name is Dr. Amber Arshad and I'm a postgraduate trainee at King Edward Medical University. And today my topic of presentation is universal health coverage and financing. In this presentation, I shall be giving a brief introduction to the universal health coverage, the relation between universal health coverage and how health financing is managed, and what are the challenges we are facing currently right now, and how universal health coverage and primary health care are interrelated, and what is the role of primary health care in providing this achieving this universal health uh, throughout the country, what can be done, and a reference article uh, to see if the what our findings and the other areas either they are having similar findings or different findings. So at the end of the presentation, the participants will be able to describe what is universal health coverage, its challenges currently being faced in our country, and what interventions can be done to improve health financing system in Pakistan. So a brief about the universal health care or the universal health coverage. So actually it's a universal health coverage means people have access to all the services you need, and it has three basic components that it is based on three pillars. What is the full spectrum of the health services, that is according to the need, that is equity based, financial protection of the different payments for the health services when consumed or how the finances are managed, and third the coverage for the entire population. So universal health coverage road, it is actually the for achieving the universal health coverage throughout the country. That is the one of the targets that has been set in SDGs in 2015, and there was also a meeting at at United Nations in 2019 for this purpose, and some countries are also making progress based on these health related targets and goals. And actually it all emphasizes on what services are covered and how they are funded, managed and delivered. That makes the core of this whole universal health coverage concept. So this is the cube, you are all familiar with it. It has three axes and three dimensions of population, services and the financial protection, or you can say that how much how much the people are paying out of pocket. And this center is the central cube is the current coverage mechanisms. How much this area fills, the better the coverage of the services you are being provided. So achieving the universal health coverage requires multiple approaches. I will be brief over here. One is the primary healthcare approach, and second is the life course approach. So it all starts with the primary healthcare approach, where integrated health services, policies, engaging powers and families, social participations, and the life course approach optimizes and addressing the needs for all the ages and providing guiding principles based on human rights and gender equality. So currently, how our financial system and how our universal health coverage is facing some of the difficulties. The total budget we are being provided is limited, and under those resources, we need several. We are facing some challenges, like we have a limited budget, and we have limited sustainable funds. We have limited medical coverage, and based on the financial status of the family, that is lacking. So there is a need to be this part to be addressed. The integration between the national database and HMIS is also fundamental. So this, for universal health coverage, it's important. And mostly it's outpatient departments where most of the people are treated, and they are mostly out of pocket payments. And one of the important part, that more public facilities or incentive investments in private health facilities, that could be one of the challenge, but still we are trying to have these more public private partnerships to manage the finances and the whole financial system, the tax based, the revenue based, the out of pocket payments, the privatization. These all are the challenges currently right now for our public private partnership is one of the part. So these are all the challenges. So what is there was a document that was present on WHO that was towards primary healthcare for universal health coverage and sustainable health financing in Pakistan. Actually, the document have some key objectives, and the mission of and the objectives were to review the progress of this primary healthcare and health financing reforms towards the universal health coverage, and to agree on a medium term multi-partner support agenda, including opportunities to leverage existing and external financing. Actually, the main agenda was to align the technical support to foster the government's stewardship in implementing its national strategies and plans, and also to align the government monitoring systems that is based on evidence generated through these several programmatic data and national databases to that would improve the primary healthcare services, through which we can improve our universal health coverage, strengthening the multi-partner and multi-stakeholder coordinations that could empower the communities to enable their meaningful involvement. And this all program, the joint, was supported by World Bank and the management, financial management part, and the health financing matrix of WHO and Gavi. So primary health care for universal health coverage in Pakistan, actually it was a joint that all started with Asthana Declaration in 2018, and that recognized that primary healthcare provides a platform for accessible, affordable, equitable, integrated, quality prime care and public health services for all. So it focused on this multi-sectoral action, engaging people in communities in their own health and well-being. And there was also these declarations like General Assembly political declarations and the Salala declarations and the primary healthcare health financing reforms that are the key priorities for the federal and the provincial government. And also the national health vision also had that targets at the and the provincial health strategies. So they also started in for universal health health coverage investment case. There were started there was a base laid for the universal healthcare benefit packages that were endorsed for Health and Population Council on 23rd of October 2020. There was also an implementation of Sehat Sahulat program that was actually the health insurance program for all the families, especially the family that were living under poverty line. And there was also efforts for strengthening multi-party, multi-stakeholder coordinations to enable the government of Pakistan to develop a national primary health care for universal health coverage. So there were also an initiative that were taken by the government for equity, for enhancing the equity and the equal distribution of the resources and the funds throughout the primary healthcare, the secondary healthcare units through upgradations. Most of the BHUs, RHCs, some of them were upgraded. 24/7 services were provided, doctors were provided, paid jobs were provided. That are all the initiatives that could help in enhancing that universal health coverage throughout. There were also efforts made for the involvement of basic health units, the rural health centers, and the civil hospitals, and also there were also efforts made so that equal services are provided at all these basic units, so that people must have equal and need based need according to the need, their services provided according to their need. So that was the Sehat Sahulat program. That was one of the efforts to provide the health insurance to everyone, especially living below poverty line. So what can be done? It can be done that we can strengthen the district governance, achieve a progress, increase and diversifying the universal health coverage financing, and prioritizing the community and the primary levels. Strengthening human resources for health, like province-driven approaches that prioritizes primary healthcare force, and also ensuring equitable and resilient access to healthcare services, and also improving healthcare quality in both public and private sectors. And this public-private partnership, because the private sectors are more established in our country as compared to government sectors, and these private sectors can fund and can generate more funds. So there is a possibility that if we strengthen this relationship, then there are chances that we can achieve this universal health coverage. This was an article that is related to all the challenges and all the interventions, or all the things that could be done in our country. And this was the health financing of the universal health coverage in sub-Saharan African region. Some of the findings of this paper and all the things that they suggested in the conclusion and in the discussion session were quite relevant with our situation. So the findings of this study can be implemented in our country for improvement of this whole health financing for the universal health coverage. So it was actually this was a small background that was given that actually highlighted that in sub-Saharan region, most of the payment is through out-of-pocket payment. And a health financing framework was developed by WHO that highlighted the financing strategies should be integrated with national health policy. That was the agenda in these countries. And I think that would be a good strategy if implemented in our country. So strengthening domestic financing is crucial to avoid this out-of-pocket payment. And the gross domestic actually spending at least 1% of this GDP on health target for sustainable development goal. Actually by WHO is 5%, but here it's 1%. So aim of this study is a systematic review to report the health financing mechanisms in the sub-Saharan sub-Saharan African region through published literature. So this systematic review was done according to the preferred PRISMA guidelines and the registered on Prospero. The timeline was from 2005 to 2019. And the four databases and the databases that were used were Medline, Embase, Web of Science, Global Health Database, the Cochrane Library, Scopus, and JSTOR. The period focused on what was actually the timeline was this, and different keywords and medical subject headings were used, and with Boolean operators like OR. Study selection and eligibility criteria included these that qualitative, quantitative studies and French studies and studies that did not mention universal health coverage were excluded. And later on, the snowball procedure was used for further selection. This was the procedure, and in the end, 39 studies were selected. So this was the timeline from how many studies from what year were selected, as you can see in the timeline. I'll quickly go through it. And data extraction was done by 2 independent reviewers. Full text studies were included, and data extraction was followed by the guidance of this Cochrane collaboration qualitative method groups. Synthesis method was based on population, health financing approaches, as well as limitations, conclusion, recommendations. And descriptive themes were developed based on the findings. And also the quality assessment was done according to this quality checklist and Joanna Brigg Institute appraisal tool. Coming to the results, overall 39 papers were reviewed after inclusion, and the themes that were generated based on national social health insurance, community-based health insurance, tax-based, donor funding, and other forms of insurance such as private, voluntary, and micro health insurances that are explained later on. The articles reviewed were focused on the issues of healthcare revenue and that were from direct out of pocket. And another common health financing mechanism throughout the region was external donor funding and was reported by most of the studies. These were the categories, themes that were identified, and out of pocket was the top at the top. One of the the national and the social health insurance that was identified is a compulsory system that deducts contribution payments directly from the employee payrolls. So it can be one of the health financing mechanisms that can run in the country. But however, in lower middle income countries where formal sector is relatively small, majority of population are in informal sector. So this approach is less suitable and less sustainable. And this approach also goes for Pakistan as well. So second theme that was identified was community-based health insurance. A minor number of people enrolled in this community-based health insurance experience improvements. However, it is inequitable across the populations, and the retention of its members is a challenge. So one of the examples of this that was happened in Kenya through the support of external funding, and they consecutively ceased following the discontinuation of funding by the donor fund, suggesting that the importance of sustained donor support for such schemes. So This is also a good approach, but since a little people, a less amount of people are enrolled, and keeping the people in the scheme is difficult. So there are also pros and cons for this type. So there is also a third type, that is the tax-based financing, that was identified in some countries, and is also good for achieving this universal health coverage, that focuses on giving the population access to health services irrespective of their socio-economic status. And as finances for healthcare are collected by the government from tax revenue, so the socio-economic status is slightly overlooked, should be overlooked. In order to accelerate the progress, especially in Nigeria, a recent study proposed that the national policymaker should consider the tax-based, non-contributory universal health financing system as a principal method. And one of such method was suggested in Kenya, with utilization of tax funds to provide subsidies for the poor and simultaneous development framework to help. So this is one of the system that can work here as well in our country, if the tax-based financing, strong tax-based financing system is developed. However, it's running but it's weak. External funding includes the donor funding and assistances from either within the country or maybe outside the country, and which suggests a level of dependence on effective use of external funding. But it relies on good governance and leadership. And this type of financing mechanism, albeit helpful, may lead to further challenges as funds allocated to for vertical programs, target specific diseases, and all that. So results in insufficiencies in the health systems and displace domestic resources. So good leadership and good governance are the keys if these external fundings are to be directed towards the right direction. Other forms identified for this health insurance were other types like voluntary private health insurances, micro health insurances, but these are more regressive, less equitable type of insurances. One of the approaches was the innovative financing approach. And it's increasing government health with an increasing government health expenditure and developing tax-based systems, improving tax compliance and revenue collection efficiency and implementation for the so-called sin taxes. For example, on alcohol, tobacco, air travel, embarked on health sectors and as financing mechanisms. So these innovative financing approaches include all these um, um, uh, systems with syntaxes. That is one of the method for generating the revenue. So it's important to learn successful strategies, and one of the lessons learned from all the studies that were included is enhance the public-private partnership. By leveraging the potential for the private sector, that is important to leverage the potential of the private sector to complement the public sector efforts, and developing innovative domestic financing by improved efficiency in tax collection to support the generation of this is very important, because nowadays these public private partnerships are crucial, and if we allow this, then there is a chance that we can generate revenue that can be used for the public sector as well. Cultural solidarity and resilience were important for the success of this. For example, there is a community-based health insurance scheme and is a public-private partnership based. So cultural solidarity and resilience were important, and this was found in Uganda. So little bit that was discussed later on in the systematic review was that there is a need for the reliance on out-of-pocket payments to be reduced, to provide a financial protection and improve affordability, also to ensure the quality health services, and to provide basic amenities for health facilities is very important, especially that are lacking in the rural areas and they require investment. So investment is very important. And considerable challenges is the dependency on the donor funding. That was one of the challenge that was highlighted in almost all the studies, and developing effective strategies to strengthen domestic financing mechanisms is important. Last is concentrated efforts at various levels that between local governments, donors, and private sectors will be necessary to provide resources targeted for vulnerable population. And more than half of the studies included emphasized on the value of these PPPs in health financing reforms, requiring coordinated efforts to address quality, efficiency, and financing issues in the health service deliveries. So coming up to the conclusion, so this was to recall all that, this a thematic analysis posits that the strategies for the health financing for the universal health coverage ought to be attuned to the contextual setting, and there is a need for evidence-based, coordinated, multi-sectoral strategies tailored for in the country's context to provide the sustainable solution for these complex issues, particularly as we have seen in COVID-19 pandemic. Appropriate health financing mechanisms to support universal health coverage and sustainable health services are vital. So further research could explore, I would omit here COVID-19, but could explore the global health security resilience and capacity building for the universal health coverage. And thank you so much. Anyone?
Dr. Amber, before anyone starts asking you the question or start commenting on your presentation, I believe that you are one of the gem that was hidden in my group. I did not know about your presentation skill before you presented this. It was really an excellent presentation. The material which you showed on the slides is extremely relevant, focused, and comprehensive. I have only one negative feedback that I would like to give you after the presentation, after everyone, they give you, they ask you their questions. Otherwise, absolutely great presentation.
Okay, sir.
The material is really very, very focused. That's how you present at an international level. So the floor is open for questions.
Yes, sir.
We can go one by one. Ji, Dr. Rusha.
सर मेरा तो कोई क्वेश्चन नहीं है। जो प्रेजेंटेशन इन्होंने बताई बड़े अच्छे फोकस पॉइंट थे, कुछ मैंने ज्वाइन भी लेट किया। मेरे जहन में सच कोई क्रिटिक नहीं आ रहा इसमें। थैंक यू।
डॉक्टर इकरा, आप